Great. Well, thank you so much, everyone, for coming. My name is Dr. Florencia Halperin, and I'm the Chief Medical Officer of Form Health. And I'm delighted to talk with you this evening about weight loss medications, which is a topic I think many people are interested in learning more about. Thank you for your interest and for coming, and please feel free to ask as many questions as you want in the chat section. The goal here is to be able to answer your questions. So I have just a few slides to go over some basic concepts, but I am very excited to answer the questions that you have brought. So without further ado, what I wanted to cover, let's go to the next slide. Is how our bodies regulate weight, because how our bodies regulate weight is really, we have to understand this to understand how weight loss medications work. So then we'll talk about how they do work. And then we'll talk about the different medications that are available on the market for weight loss. And then we'll talk about how much weight people lose using these medications. Okay, next slide. Okay, so a very important question for us to think about that really underlies why we use weight loss medications at all is how our bodies regulate weight. And this is something that many people don't know a lot about, because I'm sorry for all these dinging. Let me see if I can turn it off. I apologize. Many people don't realize that our bodies actually control our weight. And this actually makes a lot of sense because our bodies regulate so many things, right? Our biology, for example, wants our body temperature to be at in a certain range, and we can shiver and we can sweat and we can do all kinds of things to keep our body temperature in a certain range. And believe it or not, with weight, it's the same thing. And many people have, for many centuries and many decades, thought that this actually was just a person's fault. Like you were someone who was, indulgent and just wanted to eat the right foods that tasted delicious and didn't want to exercise a lot. And that's how we gain weight. And the reality is we now understand that a lot of biology determines where our body wants to be in terms of weight. So for example, your genes, what you inherit from your parents, plays a big role in where your body wants to be, what weight it is regulating to. And then things that happen in our life, even how during embryologic development, what happens in the womb, how our mothers eat, our mother's weight, all of these factors, early childhood feeding, play a role in where our body wants to be in terms of weight. And we have a lot of different mechanisms for doing this. So to put it simply, we can drive hunger and we can drive burning energy. You can drive it or you can lower it. So obviously when you drive hunger, it leads a person to eat more, take in more calories, and then we're very efficient at storing calories. Everything that our body does comes because it brought some evolutionary advantage. So our bodies are programmed to store calories. That's our pantry. That's our safety net for when there aren't calories in the environment, we can mobilize those stores and burn them for fuel. And so those are the kinds of mechanisms that our body can use. It can drive hunger. And then when it wants to use up those stores, it can burn more energy, but it can also burn less energy when it's trying to conserve, when it's trying to say, wait a second, there aren't enough calories here, I need to conserve, we can downregulate our metabolism. And all of these signals, how does your body know that you need to be more hungry and eat more now, or that you need to burn a little bit less energy now? All of this is a very complex, very elegant, very beautiful network of signals. And so when you eat food, believe it or not, hormones are generated that go to your brain and tell your brain, okay, we've had enough. But right before we eat, the hormones that are being generated in our system and going to our brain say, eat, we are hungry, we need to eat. So all of these signals are hormones, and the hormones in the brain actually are what control our hunger, but the brain and talks to the fat tissues. It talks to the gut because our guts know that we're eating, etc. So very elegant, very complex, and this is all the background. Let's go to the next slide. So because of all of these hormones that we've learned about and all of these biological systems, research has been able to take advantage of these chemical pathways in our brain and develop drugs. And the way that these medications work is they tell our brain that we are full, and they tell our brain that we don't need to eat anymore, or that we don't want to eat. And they also decrease craving. So instead of kind of having that desire to go and eat and that hunger drive, the medications help by reducing those pathways in the brain. So there is a list of medications, and we're going to go over them so that everybody understands how the medications that are available work. But there's a really key thing that I want to emphasize, which is that when you think about using weight loss medications, we have to make sure that it's kind of the right people who are thinking about it and the right match for the individual. So the only medications that we work with are FDA-approved medications for weight loss, or FDA-approved medications. Sometimes these are medications that are approved for something else, but they cause weight loss, but they're still FDA-approved medications. And the FDA says that the people who could use weight loss medications would have a body mass index, which takes into account your height and your weight, above 30. Or above 27 if you have metabolic complications from the weight. So if you already have diabetes or fatty liver disease, high blood pressure, high cholesterol, those kinds of conditions mean that you could be a candidate for weight loss medication at a lower weight. So a body mass index of 30 is what defines the diagnosis of obesity, which is the chronic disease that I've been kind of talking about, where the body is defending a higher weight through all of these pathways, and we can treat it with medications to sort of set the weight that that body wants to be at a little bit lower, drive less hunger, drive more fullness. So those are the weight ranges that the FDA has determined. But another very important thing is that not everybody who has a body mass index above 30 should take weight loss medications. We typically think about people needing weight loss medication or being a candidate for it when they have been trying a lot of other strategies. They have been engaging in healthy habits, healthy nutrition. They are exercising or doing physical activity. They are seeking help and getting professionals to help them with making changes in a way that is sustainable. They're doing all those things, and they're still not losing weight. That is one circumstance in which we might think that someone with a body mass index above 30 and meeting those conditions would really be able to benefit from a medication. The other group of people that we think about should consider using medication that could really help them is people who have been successful at losing weight. They are able to do a program or do some intervention, anything that they want to do with, whether it's with a professional or on their own with resources online, however they find success. So they lose the weight, but then they regain it. They gain a little bit more. And they've done this multiple times in their lives. So when it's that kind of situation, we know that we're really up against the biology, that the biology is driving the weight back up each time. And that's when we think that a medication may be very helpful for an individual. In general, when someone hasn't tried to lose weight by any other means, this is not the first thing that we go to. We go to this when nutrition, physical activity, behavior changes are in progress, doing pretty well, still don't see weight loss, or this person has done it many times, lost weight, but then regained. And it is just so critical that people don't think about weight loss medications as like this easy thing where you just kind of take a pill and don't do any of the other work. And I'm going to show you how the reality is that these medications really only work the most that they can work. They give the best boost that they can give when it is combined with really healthy habits, healthy nutrition, physical activity, and thinking about how people can change their behaviors in ways that they can sustain over time. So it's really kind of the total package, and what medications can do is drive that hunger drive in the brain down so that people can stick to the plan. You still have to have a plan. When the eating is really, really off target and there's a lot, for example, of fast food being consumed, it's going to be hard for the medications to really do their full effect. But when someone's trying very hard and they're not having success, then the medications can really be game changers. And that's what we've seen. And so before I get into kind of each of the meds, I just want to say that what we do at Form Health is we really support people with all of the parts. So our patients see their physician. All of us are board certified physicians and specializing in obesity medicine. We see you once a month. And then you see the dietitian on your team. You get a team of a doctor and a dietitian. You see them every 2 weeks for a video visit. So we are really helping people to optimize their nutrition, to be leading their healthiest lives, to be making habits that they can sustain for life. And at the same time, we may use weight loss medications when that is not sufficient, or when there's this lifetime history of not being able to lose weight with all the other strategies. And we know we're up against that biology where a medication would really be helpful. Okay, so let's get into the different kinds of weight loss medications. And let me see if I have one question. Oh, no, this is just Kim inviting you to ask more questions. Okay, so the most exciting medication in this space right now is semaglutide, which is called also Wegovy. And the reason why this medication is very exciting right now is because the weight loss with Wegovy is better than with any other medication on the market. So on average, people lose about 15% of the weight that they start at, whereas all the other medications have been in the kind of 5, 8, maybe 9 or 10% weight loss, but Wegovy has really shown excellent results. And this medication is a type of medication in the class called GLP-1 receptor agonists. GLP-1 is a hormone that our bodies make that signals to our brain. We make it in our gut, and it signals to our brain to not be hungry, to eat less. And so you feel full when you take this medication. You're not as hungry. You don't have as many cravings, and it can really help people lose weight. A sister medication is liraglutide, or Saxenda, which was approved first for weight loss, which was a daily injection, and semaglutide is now a weekly injection. So they kind of improved it. They made it more potent. They made it more long lasting, and it translates to better weight loss results. They are both injections, so people have to be able to be willing to inject themselves to take this medication. The other medications are all pills. They're not injections. There's a combination of a medication called naltrexone and bupropion. Both of these medications are generic. They've been available for a long time. They were approved for something completely different. But when combined, it turns out they really decrease cravings and they help people to lose weight. So sometimes we use Contrave as a brand name medication. Sometimes when people already take bupropion, for example, for depression, we can add naltrexone and see if it will help them to lose weight. The only medication on this list that does not act in your brain, that does not do what I've been talking about of affecting the hunger regulation in the brain, is the next one, orlistat. Orlistat is actually a medication that inhibits the absorption of fat in your gut. And so the fat in your food does not get absorbed, not all of it gets absorbed, and people pass the fat and therefore lose weight. This is a medication we very, very rarely use. The next kind of two medications have at their sort of part of what they are made from is phentermine. And phentermine is an amphetamine derivative. It is a stimulant, but it is the only medication on this list that is generic, and it's approved for weight loss as a generic medication. So it is the most cost effective, and it's the most widely prescribed in the US. You can combine it also with topiramate, which is another medication that's been around to prevent seizures and used also for headaches. Phentermine combined with topiramate is more effective than either medication alone, and it's sold as Qsymia under that brand name. Now, phentermine is a controlled substance. So when programs like Form Health, which only use telehealth, we never meet people in person. We always meet with them through telehealth, which is fantastic for convenience and for being able to make a really close connection with people and seeing them often and support those lifestyle changes that we've been talking about. There's a limit on prescribing phentermine, and it is not allowed by the federal government to give prescriptions for controlled substances without meeting people in person. However, that has been waived during the public health emergency. So if anyone had a telehealth visit and got prescribed phentermine, it has been allowed over the last few many months during the public health emergency, but otherwise it is something that's not allowed. And then the last point that I wanted to make about medications is that there are also medications which are not approved for weight loss. They may be approved for diabetes, they may be approved for other indications. However, they do cause weight loss. And the best example probably is that GLP-1 receptor agonist category that I mentioned with Wegovy and Saxenda. Both fall in that range, in that category. These medications were originally approved to treat diabetes. And so they lower blood sugar at the same time that they help with weight loss. And so they're great medications for people who have diabetes and have obesity because it treats both. But sometimes they're used off-label. The diabetes version of the medication is used to treat people who have obesity, but who don't have diabetes. And similarly with metformin and topiramate, which I already mentioned, these are medications that are FDA approved, they're FDA regulated. That's really, really important, but they're not specifically approved for weight loss. But doctors and healthcare professionals who can prescribe are allowed to use medications in different ways. And this is very well established in the obesity medicine community to use these medications for weight loss. So sometimes that's what we do, particularly when there are cost issues, because the list of medications on the left, as I already mentioned, phentermine is generic, but everything else can be very costly if it's not covered by insurance. So some of the work that we do with our patients is to help them find which medications are covered by their healthcare plan, can be affordable for them, so that we don't make a treatment plan which the person just can't afford at all. That doesn't make sense. So we work with people to help them find the medication that's right for them for many reasons, because it'll help with weight loss, because it could help with other medical issues that they have, like diabetes or headaches, and because it's going to be affordable for them. Okay, so the last thing that I want to say, and then I'm going to turn to answering questions, and I have a few questions here. Thank you very much, is on the next slide. I just want to come back to the point that we have to think about weight loss medications as helping us to stick with healthy living plans and helping to change the underlying biology that's driving weight gain or difficulty losing weight. But what I want to show you is a very quick scientific study. It's a little bit of an older study, but it's quite amazing in what it showed. So in this study, they compared 4 groups. One group just went to the doctor and got a prescription for a medication. This medication is actually one that we don't use anymore, but it doesn't matter because a lot of studies have shown this. Another group went to 30 sessions for lifestyle change counseling in 1 year. It was a very intensive program, in a way similar to Form Health, in that people were meeting with their professional team quite often, multiple times a month, to really engage in lifestyle change. So 30 counseling sessions. In the next group, they combined, you did the 30 counseling sessions, but you also got the medication. And then in the last group, they had people get counseling from their primary care doctor, and they had 8 short sessions of 10 to 15 minutes in each each time, and they got the medication. So what happened, you can see, is that the people who did the medication plus the intensive lifestyle counseling, the 30 sessions in 1 year, they lost 2.5 times more weight than the people who just picked up the prescription. So really the way that these medications work is everything together. We have to think about optimizing nutrition, healthy diet quality, healthy eating habits, moving our bodies, using the strategies that science has shown help us change our behavior and make things stick over time. That includes, for example, logging, writing down what you eat, or taking pictures of what you eat, accountability, making small goals that you can add up over time. Those kinds of things are what is taught in these lifestyle change kinds of programs, including in the study and at Form Health. And you can see how much it's really the combination of that with the medications that really helps people to be successful. Okay, so let's see. I have several questions. Thank you very much. Yes, someone raises the problem that they have not been able to manufacture enough Wegovy. This is true. It came on the market. There was an unprecedented prescription writing for it, and then there have been problems with shortages. We have many patients who are taking it and they're doing great, but there have been a problem with shortages. The company is working very, very hard to manufacture enough. And someone is sharing their experience. Thank you for sharing it, that it works for them. When they eat, they feel full, and they've been losing approximately 1 pound a week, which is right on target. Very happy to have found the medication, but would like more support from the doctor. And I do agree that it is very important to have support. And that's exactly the point I'm trying to make. It's really everything together that's going to help you be the most successful. Increase the dose after 1 month. Okay, so yes, some of the medications, you don't start at the full dose from the beginning, you ramp them up slowly. Now, another point that is kind of asked in this question is, how long do we have to take medications for? And thank you for bringing that up. That's an excellent question. If you think about most medications that people take, including for high blood pressure or for diabetes, they do not cure the underlying disease. They help while we take them. And so when you think about the biology of the brain and of weight regulation, which we touched upon, medication is doing something biochemically that is helping you eat less and feel less hungry and have fewer cravings. And in order for you to continue to have those benefits, you have to continue taking the medication. So these are really chronic medications. However, some people really use these medications and are able to kind of turn around their lifestyle, start eating very differently, start exercising a lot. And when that happens, it's always reasonable, if the person has lost the amount of weight that they wanted to lose, to do a trial of going off the medication and seeing what happens. And some people are able to come off the medications and stay off, and other people start to have weight regain. And what studies show is that many people will have weight regain when they come off the medications. But that is not, many of my patients find that very scary, but that's really not different from any other medications that doctors prescribe. They work when you take them. And we know that there's underlying biology, that this is a chronic disease. And so from that point of view, it makes sense that you need to continue taking it for it to continue to work. Okay, so do not prescribe. Okay, thank you for bringing up the issue of thyroid cancer. The GLP-1 receptor agonist medications like Wegovy and Saxenda, semaglutide and liraglutide, they have a warning on the label that people who have had a certain type of thyroid cancer should not take them. Now, it's not all thyroid cancer. It's a very specific kind of thyroid cancer, which is familial genetic, but also these warnings on the label come because rodents, when they do tests on rats and mice, these rodents have the receptors for that medication on their thyroid. The receptors are in your brain. That's how it helps to help you eat less. They're also in your gut, and they stimulate insulin, and that's how they help lower blood sugars. Rodents also have them on their thyroid, and in very, very large quantities, rodents have developed some signals of the potential for thyroid cancer. However, humans do not have these receptors on their thyroid. So it is widely believed, despite the warning on the label, that these medications are not a high risk for thyroid cancer in the average individual. And it's really only in very rare cases where there's a known genetic risk for thyroid cancer that we might, specifically avoid them. But otherwise, it's generally thought not something for humans to be too concerned about. Okay, so someone is talking about having an allergy to food. Okay, so two questions. One is more directly related to medication, so I'm going to take that one first. So thank you for asking. I mentioned kind of chronic medication use may be appropriate, but it's always reasonable to work with whoever's prescribing the medication to do a trial of coming off when a person feels ready. And the person who wrote in made a very good point. It's another thing that we do is sometimes we're able to lower the dose of the medication so that you do continue to take it over time, but at least you're on the lowest possible dose that will help you stay at a maintenance weight. Sometimes with some medications, people also take them on and off. They take them for a bit, then they stop, and they take them for a month. So people can work with their doctors who are prescribing the medication, or their healthcare professionals who are prescribing the medication, to work out a system that really works for them. And exactly, it may be that you don't need as much for maintenance as you did to lose weight. And if you can be on a smaller amount, well, all the better. Okay, so another person asked about being allergic to some foods. So that I think that would definitely be something that you could benefit from working with professionals. So our dietitians are very, very knowledgeable. Our physicians are very, very knowledgeable about different kinds of dietary preferences. Some people can't eat certain foods because they're allergic or intolerant, or they have medical conditions that you can't. And we can definitely work with that. And the advantage of working with a professional team is we have a depth of expertise. So we will try something, and if it doesn't work, we can try something else. And if there's some foods on your list on any list that you can't have, we can work with that too. And by the way, the same is true of medications. The medications, when I tell you how effective they are for weight loss, most of them 5 to 10%, this newest Wegovy more around 15%, that's an average, but each person has a very different response. So for some people, one medication doesn't work at all, but another one works tremendously well. And we all have patients, which is, what's wonderful, patients who do so much better than expected. They really lose much more than the average. It's just a very good fit for their chemistry with that medication. But it's not uncommon to try one, it doesn't agree with the person, or it doesn't work for the person. So then we have to try something new. So that's why it's important too, to be kind of on a journey with your healthcare team who has expertise in this and who can be helping, whether it's different foods or different medications or different strategies for exercise or whatever it is. You want to be working with a team that can give you different options. Sometimes things work for a while and then they stop working. And that doesn't mean you're doing anything wrong. It's our bodies kind of trying to fight back that weight loss using all the strategies that we have from evolution that have helped us stay alive. And to fight that biology, we may just have to change it up a little bit and do things differently than we had been doing them before. That is part of the journey. Okay, one more question that we have time for. Let's see. Does Wegovy have a healthcare team? I'm not totally sure what these folks are asking. Wegovy is a medication. The company that makes Wegovy does not prescribe it. You need to find a healthcare professional. It could be a physician, or it could be a team with a nurse practitioner or a physician's assistant or something like that, working with a physician at the head. We would be the ones to prescribe the medication. So at Form Health, we have a team that's led by a doctor and a dietitian, and the patient gets matched with that team. We follow you, through the course of time, and we provide the longitudinal care, and all of the lifestyle counseling that I talked about is so important. And we can prescribe the medication when it's right, and we can really try to find the right one for the individual, which is an important decision-making process. By the way, that also involves checking labs and really understanding what's going on with the person, and then continuing to follow, because the dose needs to be adjusted. If it's not the right medication for any reason, we need to think about changing it, and so on and so forth. So it's really a kind of a journey that we're on together to help you, to help support you, and to help give you different tools so that this time it can really work and work for the long term. So with that, we are at 7:30. I wanted to show the last slide, which talks about how to get in touch with us if anyone is interested. And then there's one more question, Kim. I'm going to sneak it in for this person who posted, if 1.7 didn't work, that's a dose of Wegovy, do you think 2.4 will work? So the effects are dose dependent. The more you take, the more effect you have. So it is possible that 2.4 will work better than 1.7. However, there are some people in whom it doesn't work. And 1.7 is a pretty good dose. It would be unusual to see no effect whatsoever at 1.7 and then have tremendous effect at 2.4, but it's definitely worth getting up to the full dose as long as you can tolerate it and seeing how your body reacts to it. And then if there is no weight loss, it's just really not helping. It may not be that right chemistry with that person's sort of brain and hormone and all the signals that I talked about at the beginning. And so that would be an indication to maybe try a different option. Great. Well, I appreciate everybody coming in the evening, and thank you for being so engaged and asking wonderful questions. I hope you've learned something. And if you're interested in working with us at Form Health and considering lifestyle changes, nutrition, and physical activity for healthier living, as well as possibly weight loss medications, that we would love to work with you. Thank you.